This is the second episode of endometrial cancer, and I hope you have already watched the first one. If not, don't worry, I have provided the link below. In the first episode, we discussed about the prevalence of endometrial cancer association with obesity and why obesity can increase the risk of endometrial cancer significantly. In this episode, I would like to talk about how we are going to investigate endometrial cancer, and also we are going to look into two risk factors for endometrial cancer in far more detail, such as taking tamoxifen and Lynch syndrome. Please leave your comments and I will get back to you as soon as possible. Let's start. Let us carry on with the discussion about endometrial cancer. We have already discussed endometrial cancer is the most common gynecological cancer, is highly associated with obesity, and the incidence has increased significantly in the last 20 to 30 years. Also, we have discussed why obesity is such a significant predisposing factor for developing endometrial cancer. In this video, I would like to discuss more about how did we get the numbers. For example, we know that in women with postmenopausal bleed, endometrial thickness of less than 4 mm reduces the probability of having endometrial cancer to less than 1%. We are looking to systematic reviews that concluded 4 mm is a safe number in order to initiate further investigation. Also, I would like to mention screening of asymptomatic women in general population does not reduce the mortality from endometrial cancer, and in women without abnormal vaginal bleed, the same threshold of 4 mm is not acceptable due to high false positive rates. When we have a patient with suspected endometrial cancer, for example, if she presents with postmenopausal bleed, the first investigation is transvaginal ultrasound. In transvaginal ultrasound, we look at two criteria. One of them is endometrial thickness, which if it's more than 4 mm, you have to start further investigation. And also we look at character of endometrium. Is it polycystic? Is it hypervascular? And if there are other suspicious features that initiate that, other suspicious features can increase the possibility of having endometrial cancer. Let's look at a couple of studies that performed, one of them in 2010 and the other a couple of years later. One of the most important systematic review published in 2010. They looked at 13 studies of 2,896 patients with postmenopausal bleed, and 259 of them were diagnosed with endometrial cancer. They concluded if we use the cutoff of 4 mm, it has a sensitivity of 94.8% and a specificity of 46.7%. And also, based on this study, if endometrial thickness is less than 4 mm, the probability of endometrial cancer is reduced to less than 1%. In another study, more recent systematic review, they look into 17,339 women with postmenopausal bleed, 1,341 of which diagnosed with endometrial cancer. They look into 44 studies from 25 countries. In this study, they concluded that if endometrial thickness is less than 5 mm, it has a sensitivity of 96.2 and a specificity of 51.1. As we can compare the 4 mm to 5 mm, the 4 mm has got sensitivity of 94, roughly specificity of 46, and if we use the cutoff of 5 millimeter, has a sensitivity of 96 and a specificity of 51. How we can imply this in clinical practice? It means that if we increase the cutoff from 4 millimeter to 5 millimeter, sensitivity and negative predictive value are almost the same, but improved specificity, reducing the need for invasive diagnostic procedures by up to 17%, which is quite something interesting to look into it. Also, if you remember, we mentioned that when the woman has transvaginal ultrasound, we not only look into endometrial thickness, but also we look at the character of the endometrium, because in the study published by Epstein et al., they have clearly mentioned a heterogeneous endometrium with cystic changes is highly suspicious of underlying endometrial disease. But remember, in women who take tamoxifen, they develop something which is called benign subepithelial stromal hypertrophy. It causes a grossly abnormal endometrial signal and consequently a high false positive rate. But as we all already know, tamoxifen is quite challenging when a patient on tamoxifen and present with postmenopausal bleed, because tamoxifen is associated with a threefold increased risk of endometrial cancer, and treatment beyond 5 years increases risk by at least fourfold. Let's talk about Lynch syndrome. As we know, Lynch syndrome is one of those conditions that increase the risk of endometrial cancer, and this is something that we need to know inside out if we are looking after patients with cancer, or we are working in a department which is highly likely you encounter patients with these conditions. A brief review, but whatever you need to know, I have summarized in these 2 slides. Lynch syndrome is autosomal dominant. The mean age at diagnosis is 47 years old. Increased the risk of both type 1 and type 2 endometrial cancer. As you know, we have got 2 types that I'm going to address them in another video, but remember, Lynch can increase the risk of both type 1 and type 2. It increased the risk of endometrial cancer up to 40 to 60%. It's quite significant. Just imagine the risk of developing endometrial cancer without Lynch syndrome with normal BMI is 3%, and now having Lynch syndrome will increase the risk up to 60%. And the main culprit is mutation in mismatch repair gene. If a woman has got Lynch syndrome or any first degree relatives, they need annual screening with both transvaginal scan and endometrial sampling from the age of 35. Remember, screening does not reduce mortality. After proper counseling and discussing the risk and benefits and limitation, you can offer them risk-reducing hysterectomy. Also remember that Lynch syndrome not only affects endometrium, the lining of the womb, it can also affect colon and ovaries. The other high-risk group, except from having Lynch syndrome, is women who are taking tamoxifen. What is tamoxifen? Tamoxifen is selective estrogen receptor modulator, but we know that it can increase the risk of endometrial cancer up to threefold. Remember, it does not increase the risk of endometrial cancer in premenopausal women, but it increases the risk of endometrial cancer only in postmenopausal women. I have already discussed tamoxifen induces subepithelial stromal hypertrophy, and it can cause a quite dilemma when you are performing transvaginal ultrasound. I hope you enjoy this brief video. In the next video, I'm going to discuss about endometrial cancer and prevention in general population. Please leave your questions in the comment box and I will get back to you. Thank you.